Let's go to Vancouver and bring in Jens von Bergmann. He is the founder of the MountainMath software and analytics. Good to have you on the program, and thanks for your time, Jens.
Thank you for having me on.
All right, we're looking at an initial amount of about 3 million doses. That's what we're hearing now from Public Health Canada. How effective would that be in sort of controlling the number of cases in our country?
Yes, so that'll roughly is 10% of the population that will be able to get vaccinated by about 4 months' time from now. So that won't be really enough to control the spread of the virus large scale. It will be enough to target specific groups that are maybe most vulnerable or are at risk, like healthcare workers or long-term care residents or other at-risk groups.
And that will help, although obviously that's not enough, as you're saying.
Yeah, that's right. So it'll be a slow rollout as worldwide production ramps up and Canada gets share of the vaccines that it has ordered. It's not clear yet, I think, how long that will take, but it'll be significantly longer than just the next 4 months. So we're in this still for quite some time, although there is light at the end of the tunnel.
And I know that there's a lot of discussion as well about prioritizing who gets it first. As you were mentioning, frontline workers, the most at risk, such as, doctors and nurses, people who work in hospitals, but also the most vulnerable in long-term care facilities, older Canadians, those who are immunocompromised. And then we start to sort of go out there in concentric circles into deeper levels, such as, essential workers, police, bus drivers, that sort of thing.
Yeah, so it'll be a challenge to really prioritize. It is hard. Everybody, of course, a lot of people want the vaccine, and we'll have to make those decisions. I think modeling that's going to happen at the federal level and probably also the provincial level will try to help inform what's the best way to do this with the limited initial supplies we have.
Do you have any sense of how much of the population needs to be vaccinated, Jens, in order for, us to be, out of the woods, so to speak?
So generally speaking, people are saying about 70% is what's needed really to make sure that when outbreaks do happen, it sort of naturally declines or at least doesn't get out of bounds, with maybe some fairly simple distancing measures still in place. So that's still quite a ways down the road.
What should we keep in mind, too, as we're now going to be bombarded with all of these headlines about a vaccine plan and different vaccines coming and becoming available and people getting vaccinated in other countries? What do you want people to know?
Well, it's great that the vaccine is coming, and even in other countries, it will be a slow rollout. What's important right now is that we'll have to stop the rise in the spread that we've seen across Canada, across many places of Canada, to get those numbers back down again. 4 months, even just to get 10% of the population vaccinated, is a long time, and we can't afford to keep going with rising numbers till then. So we'll have to really think hard what we have to do now. While the vaccine is good news, that's still something that is not that relevant right now to what we do today in terms of stopping the spread.
Jens, thanks for taking some time for CTV News coming on the program today. Appreciate it.